Good afternoon, students. Today we'll be learning about vitamins. So they are named as vitamin, which was coined from the words two, that is vital plus amine. Since the earlier ones identified had amino groups in them, so that is how they are named as vitamin or vitamins. Okay, so they are defined as organic compounds occurring in small quantities in different natural foods and necessary for the growth and maintenance of good health. How? See, these vitamins are very essential for the proper utilization of your other food molecules, which are the major food molecules, that is your carbohydrates, lipids and proteins. They are the energy providers. So those principal food molecules will be metabolized with the help of these vitamins. So that is how these are vital to our body and for the proper growth and maintenance of our good health. So we'll see in detail in the further slides. So coming to the classification, these are mainly classified into two classes. One is the fat soluble, another one is water soluble vitamins. It is based on their solubility. If they are soluble in water, yes, obviously they are water soluble, and if they are not, they are fat soluble vitamins. So this is the in detail classification of your vitamins. So water soluble and fat soluble. Water soluble, again we have non-B complex and B complex. Non-B complexes are your ascorbic acid, whereas B complexes we have vitamin B1, B2, B3, B5, B6. Okay, and fat solubles we have 4, that is vitamin A, D, E and K. So these are the objectives under what we are going to learn about your vitamins. Special names, chemistry of your vitamins or the structure of your vitamins, sources, recommended dietary allowance, coenzyme or their active form of your vitamins, biochemical functions and their deficiency manifestations. So coming to the fat soluble vitamins, as I said, there are 4 fat soluble vitamins A, D, E and K, and these are the different features, main basic features of your all fat soluble vitamins. All these fat soluble vitamins require bile for their absorption, like your lipid absorption, and they are absorbed via the lymphatic channels, and they need a carrier protein for their transportation, and the excess of these vitamins excess of these vitamins may stored in liver and adipose tissue, and that may leads to toxicity when there will be over supplementation, because they are not readily excreted because they are fat soluble vitamins. Coming to vitamin A. So this vitamin A is also called as anti-xerophthalmic factor. The distribution of this vitamin A, it is widely distributed in both animals and in plant foods. In animals, it is present as a preformed vitamin, that is retinol, NOL, that is alcohol form of your vitamin A. Plants, it is present as a provitamin, that is the carotenes. The active form only present in your animal tissues. So these are the sources of your provitamin, that is a beta carotene, which is a precursor of your vitamin A. All the green leafy vegetables and which has an intense color fruits and vegetables are the very good sources of your vitamin A, like your carrots, papaya, bell peppers, tomato, any other, which are the sources of your beta carotenes. And coming to sources of vitamin E, that is eggs, meat and dairy products. The vitamin A, which has preformed, it is retinol, and provitamin, the beta carotene, which can be converted to retinol, and that can be converted to retinoic acid and retinol. So this is the structure of your general structure of your vitamin A, which has a ring system along with the long polyisoprenoid chain, carbon chain, and R indicates the functional group. So depending on the R group, they are named. We'll see. So these are the three different forms of your vitamin A. So just to understand, I'm showing this structures, no need to worry. So retinol, which is having a alcohol group as a functional group, whereas retinol, that is aldehyde form of your vitamin A, which is having aldehyde group as a functional group, acidic group as a functional group in your the retinoic acid. So this is about the structures, and this is the beta carotene structure, which is a provitamin A. And coming to retinoids, retinoids are the group of compounds which has a vitamin A activity, or the vitamin different forms of your vitamin A. It may be synthetic or it may be a natural one. Okay, so they include the three forms of your vitamins, that is retinol, retinal, retinoic acid, and the carotenes, and any other synthetic analogs which has a vitamin A activity are called as retinoids. Coming to absorption and transport of vitamin A and beta carotene, as I said, beta carotenes from your vegetables and the retinol esters from your animal food. So they are acted upon by the enzymes pancreatic esterases, converted to retinol with the help of the digestive enzymes and the bile, and this bile also helps in the formation of micelles, and these micelles are absorbed through your intestinal cells, and that will be transported through the chylomicrons into the lymphatic channels, and through the lymphatic channel it enters into the blood and liver. So this is how the vitamins are, the fat soluble vitamins are absorbed. And coming to the excretion, as it is a fat soluble vitamin which is not readily excreted and some may lost in urine, aging and renal disease may increase the risk of this toxicity, as there will be impaired excretion in the aging and renal disease. Coming to the recommended dietary allowance, so it is expressed in retinol equivalent. One retinol equivalent is equals to 1 microgram of retinol or 6 micrograms of beta carotene. In adults, for men it is 1000 retinol equivalents, whereas for women it is 800 retinol equivalents, and the requirement will be increased in adolescence, pregnancy, and during lactation. Coming to the functions, its main function, the vitamin A main function is mainly in the vision, both in night and day vision and in the color vision, and to maintain the epithelial cell integrity, to provide immunity and hematopoiesis for the production of your blood cells, and for the skeletal growth, fertility both in male and female, and in the embryogenesis. So this is how the different forms of your vitamin has a different function. Retinol, which has both all the functions, retinal in the mainly in the vision, whereas retinoic acid in the growth and in the maintenance of integrity of the cell. So coming to role in vision, so the retinal plays an important role in vision, that is the aldehyde form of your vitamin A, and the overall mechanism of the vision cycle is called as Wald's visual cycle in the retina. So the retina contains two types of photoreceptor cells. One is rods and another one is cones. The rods are which are the cells responsible for your dim light or in the night, and the cones are dark light, and the cones are the cells which are responsible for your color vision and also in the bright light, that is in the daytime. So this is the picture where showing the retinal cells. So rods are the photoreceptor cells, as I said, and present in the retina, and each cell each eye contain 120 millions of rods, and each of them contain rhodopsin. That is 120 million molecules of rhodopsin will be present, and these retinal cells, the rod cells, are responsible for your vision in dim light, and visual acuity of rod cells dependent on the presence or the content of your rhodopsin present. The rhodopsin is a photosensitive pigment which is present in our rod cells. It is formed from the 11 cis retinal, that is your vitamin, and the opsin, which is a protein. So that is rhodopsin. So this is the Wald's visual cycle. So we'll see how the retinal will combine with the opsin to form a rhodopsin. So the rhodopsin will always present in your rod cells. Once the light falls on our rhodopsin or rod cells, this rhodopsin will be cleaved into all transretinal plus the opsin. So it is splitted into all transretinal and opsin. This all transretinal is converted to alcohol form, that is all transretinol, by the enzyme called as alcohol dehydrogenase in the liver. So this all transretinol is converted to 11 cis retinol by the enzyme called as isomerase in the liver. This 11 cis retinol can be converted to 11 cis retinal, that is aldehyde form, again by the enzyme alcohol dehydrogenase. So this 11 cis retinal will combine with the opsin to resynthesize the rhodopsin. So this mechanism is called as Wald's visual cycle. The resynthesis of the rhodopsin takes place here. So in the short, this all transretinal can also be converted to 11 cis retinal in the retina itself by the enzyme called as isomerase, and it can also combine with the opsin to form a rhodopsin. So the whole cycle is called as Wald's visual cycle, or the mechanism of the synthesis of the rhodopsin. This can be asked as a 5-marker or a 3-marker question, Wald's visual cycle, directly. So you are supposed to write the whole reactions of your Wald's visual cycle for 5-marker question or even 3-marker question. So how you will appreciate this rhodopsin synthesis or resynthesis? When a person entering a dark room, suddenly we are cannot able to see initially due to splitting of rhodopsin in light. Once they enter into the dark light, in the dark rhodopsin is resynthesized, after which the vision improves. So dark adaptation is the time taken by an individual to regain his proper vision in the dark, during which resynthesis of your rhodopsin takes place. So continuous supply of retinal, that is aldehyde form of your vitamin A, is required for normal visual function. So retinal deficiency depresses the rhodopsin regeneration. So then that is how interferes with the function of your rods and increases the dark adaptation time, resulting in night blindness. You can appreciate when you enter into the cinema hall and you cannot see immediately, and within a few seconds we can regain our vision. So that is called a resynthesis of your rhodopsin. So functions, other functions, retinoic acid mainly plays an important role in tissue differentiation, and it also maintains the integrity of epithelial tissue, epithelial cells, and like in skin and mucous membrane. It also plays an important role in embryogenesis, and it has a metabolic effect. It controls the rate of gluconeogenesis and controls the biosynthesis of glycoproteins and GAGs. So this is how the vitamin A, which maintaining the healthy cells in your mucous membrane, and that is your retinoic acid, where here it is impaired without vitamin E. Retinol, which is alcohol form of your vitamin A, plays an important role in spermatogenesis in men and for normal reproduction and fetal development in women, in children for the growth and remodeling of bone involving osteoclasts and osteoblasts. The beta carotenes, which serves as an antioxidant, trapping free radicals in the tissue, so that is how it also helps in the antioxidation, and protects the body from diseases including your cancer, decreases the risk of cardiovascular diseases. And coming to deficiency manifestations of your vitamin A, because vitamin A will be stored in the body, so it would take a year or more to develop your deficiency symptoms. So eye manifestations, mainly night blindness or nyctalopia, which is night blindness, which is the first detectable sign of your vitamin A deficiency. Here the person cannot see at dim light or the night times, so that is called dark adaptation, where that is due to increased dark adaptation time. And xerophthalmia, which is characterized by dry, thick or wrinkled conjunctiva. Here the cornea will be dull, hazy and loses its transparency due to keratinization of epithelial cell. So this is a normal eye where there is no any keratinization. Here you can see, here it is xerophthalmia mild, here it is severe. You can see the keratinization over the cornea. This is a severe xerophthalmia. Bitot spots, which are the spots or the plaque forms of white triangular dry plaque forms, will be seen in the conjunctiva. Keratomalacia, here it is destruction of cornea due to softening, ulceration and degeneration leading to total blindness. So these are the plaque forms you can see here. See, these are the plaques, triangular plaques of your spots, that is Bitot spots, and here it is keratomalacia, softening and degeneration, and this is leads to corneal ulceration and ultimately it leads to blindness. Vitamin A deficiency is the most common cause of preventable blindness in children of developing countries, and it can be prevented by supplementation, your vitamin A supplementation. And coming to skin manifestations, keratinization of your skin that leads to a rough, dry and scaly skin, that is called keratinization, and follicular hyperkeratosis, so where the keratin accumulates around your hair follicles, and it is termed as follicular hyperkeratosis. So this is the picture showing where the keratinization or hyperkeratosis. And the other manifestations, growth retardation, sterility in males due to degeneration of germinal epithelium, and again in the females termination of pregnancy, and infectious diseases due to impaired immunity. Coming to vitamin A toxicity, as it is not readily excreted, and if there will be over supplementation or excess consumption may leads to toxicity, which is called as hypervitaminosis A, which can occur with the concentrated amount of the preformed vitamin A from animal foods or fortified foods or the supplements. So acute toxicity symptoms will be abdominal pain, severe headache and dizziness, nausea and vomiting, sluggishness and irritability, whereas chronic toxicity may leads to bone and joint pains, hair loss, anorexia, benign intracranial hypertension. So high intake of the carotenoids do not seem to be toxic, although high intake may lead to yellow or orangish discoloration of the skin, that is called as xanthosis cutis, and they are also used in therapy. So retinoic acid is effectively used for topical application in the treatment of your acne and psoriasis, and oral dosage will be given for treating precancerous conditions, certain like in leukemias. So by this we are finishing our vitamin A. So